Hello, guys. My name's Kevin here. I'm coming to you uh, to do a another personality disorder. I did one earlier a couple of days ago, and I'm doing one now, which is borderline personality disorder. The first one I done was a cluster A, so this one is a cluster B. It's one of the more severe personality disorders. It's in the same um, personality disorder group in the DSM-5 as um, antisocial, narcissistic personality disorder, and histrionic personality disorder. Um, okay, now to start off, you have to meet the criteria of 5 of the 9 symptoms to get a diagnosis for it. So it's highly important that you see a therapist if you feel like you may have a condition like this. You really need to seek a therapist. I'm not a counselor. I'm not a mental health therapist. Not a LCP, nothing like that. I'm just here um to do videos and let the world know, um and the people that's actually got it, and the people that's around them, hopefully that watches this video, will know what the signs and the symptoms of borderline personality disorder is. Um, it can be really tough because I'm married to someone that's got it right now with a borderline personality disorder, not to the major degree, but did make 5 of the 9 symptoms, if not more. So it's definitely borderline. Um, so here we go. This is the borderline personality disorder. The first thing we're going to start off with is the symptoms. Okay. Now, if you go back and look at the movie back in 1987 called Fatal Attractions, um, you can see what borderline personality disorder is, and a lot of the involvement in that movie did look like some characteristics of borderline personality disorder, fear of abandonment stuff. This is one of the symptoms that you have to meet. Well, you don't necessarily have to, but it's usually present with borderline personality disorder. It's an intense fear of abandonment. Number one, um, even going to extreme measures to avoid real or imagined separation, rejection. Um, Now, what do I mean by extreme measures? Um, Measures such as stalking, harassing phone calls, um, could possibly, potentially. I mean, if the person goes and takes out uh, a no contact order, um, they could violate that, which could end up in jail time. But people with the people with borderline, they don't usually um, get in trouble with the law that much. I mean, some of them do, but it's not as well known as it is with narcissistic personality disorder, and especially antisocial personality disorder, that would be accompanied by sociopath and psychopathy and stuff like that. We don't, you don't tend to see that with borderline. But that is one of the symptoms where they could actually get in trouble with, if the person takes out a restraining order, and they usually leave messages and threatening messages and stuff, not you, but threatening to do intense harm to themselves. Um, and this is highly important. This is one of the real major characteristic symptoms of borderline is the intense fear of abandonment. It can be really, really intense. Okay, and then number two is a pattern of unstable relationships, such as idolizing someone moment and then suddenly believing the person doesn't care enough or is cruel. Now, this is where um, people with borderline feel like um, and sometimes it's vice versa. They feel like you don't care about them and you're just a cruel person, you're an evil person, you're the worst person in the world, and they can even turn around and it can actually be vice versa. It can work both ways that way. So they can actually feel that way by them too. Um, but even though this is not true, you know, of the people that's around them, because we do care about them. They're very, very lovable people for a lot of the time they are, but when they can have rages, um, and sometimes those rages kind of comorbid bipolar. Um, bipolar is in a lot of these personality disorders, no question about that. But it's not a bipolar itself. It's not a personality disorder. Will it be in the future? It might be. Who knows? It's a possibility, but right now it's not. It's just called bipolar depression or bipolar disorder. Um, okay, so that one, yeah, the number two is a pattern of unstable and intense relationships and idolizing um, someone and then suddenly believing the person doesn't care enough or is cruel, such and such like that. Always calling and stalking, you know, and stuff like that. That's one of that. Number three, rapid changes in self identity and self image that includes shifting goals and values and seeing yourself as bad or as if you don't exist at all. What I mean by this is such as the constant want to um, get their names changed, um, which is part of changing self identity, can be um, changing the way they look. Um, One moment they can say that they can, you know, like they want to go to the Grand Canyon, and in the next moment they just either don't want to go or they want to go in the opposite direction. It's such a sudden shift in goals. It really is. They can say, "Well, I want to live to be a millionaire one day," and then the next moment, a minute later, they forgot that they done said it. They've said it. Well, I mean, they know they said it, but it's like they didn't say it at all. Um, but that doesn't make them bad people. It really does not. I mean, you know, it's emotional roller coaster. Borderline is. It really, really is. Um, and they can devalue a person, the loved ones that they're around. Talking about, you know, is making you feel like you are really, really a bad person. Really, really a bad person. And they can go around and tell people that you are a real bad person. You've said this and you've said that, and knowing you haven't said this or and that or nothing. Um, that's one of the symptoms of borderline personality disorder. Rapid changes in self identity and self image, and including shifting goals and values, seeing yourself as bad or if you don't exist at all. They do sometimes see themselves that they don't even exist, so they feel empty inside. Okay, and number 4 is periods of stress related paranoia and loss of contact with reality, lasting from a few minutes to a few hours. This is kind of sort of like where depression comes in at with this disorder. Paranoia is like, paranoia is like derealization. That's um and it can last from a few minutes to a few hours, and it may not come on. You may not see them present that for weeks at a time, or you may see them present it every day. The paranoia, like I said, is it can be in many ways. It'd be like, like you said. I mean, they think that you told them to do something like, can you run to the grocery store and get some groceries while I clean the house? And then you ask them again, and then they say, well, I don't know that. I don't remember that you said it. Could it be, um, can that be a probable cause of them wanting you to do it? Or they don't remember it? I think it's probably in between. That's kind of sort of on the manipulation side, which is a real symptom of borderline personality disorder, manipulation, as it is with many cluster Bs. And 5th here, this is real, okay? Impulsivity and risky behaviors. Typically we see this happen on a self basis, but it can happen, though it's not as likely to happen to the other person. The one thing that I have noticed as I'm married to someone with borderline, when they go into a rage, they usually try to harm themselves, or they throw things. And here's another one, such as gambling. This can happen. It just depends on which person it is. Reckless driving, most definitely. Definitely. The reckless driving is one of the real bad symptoms of it too. Unsafe sex, yes, but then that depends on the person. Because mine don't participate in unsafe sex or nothing like that. I mean, like I said, a lot of these symptoms people with borderline personality disorder are going to have, and not going to have. Spending sprees. Yes, this is definitely a symptom of it. Binge eating and drug abuse. Absolutely. I mean, absolutely. This is primarily in a lot of cases with borderline personality disorder. This is one of the real characteristics of BPD. or sabotaging success by suddenly quitting a good job or ending a positive relationship. This can happen. Um, Quitting a job, definitely, no doubt about it. But ending a positive relationship, well, I mean, I'm not saying that it can or can't happen, but that's when you've got to factor in the fear of abandonment. The likelihood when them ending a positive relationship is they'll call you back eventually, or they may not. It just depends on the person, like I said. Okay? Suicidal threats or behavior of self injury, often in response to fear of separation or rejection. No doubt about it. And oftentimes we see um, the suicidal threats become an actual reality, and they carry it out sometimes. And those of us that's close to people with borderline personality disorder, I'm on guard, and you should be on guard. Those of you that's watching this video that are in suspicion that your loved one may have BPD, you should never let your guard down. Yes, I've had this several times with my husband, but you just you really have to watch them. Keep the medicines in your eyesight. Not with every one of them. I mean, suicidal orientations don't come with every BPD. It just doesn't. Same as some other symptoms. And then with others, it does. And unfortunately, with mine, it does. Um, so it does. Um, wild mood swings. I think it means wild mood swings. Lasting from a few hours to a few days, which can include intense happiness, irritability, shame, or anxiety. Absolutely. This can last for even weeks. I've seen it last for a week, 2 weeks, maybe even a month, or just a few minutes, 2 to 3 minutes. I've seen, and this is just based on my experience, with borderline personality disorder. My husband has gone into wild, raging mood swings that I don't know what you would call it. He would actually go unconscious. It's like a psychotic seizure or something like that. I don't know, but they go completely out of it. And this has happened to him twice. But those are the only times that I can remember that has happened. That's when they're really, 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 really mad. And anything in their way, especially an object like an expensive television or expensive computer or something like that, are very often the targets to get just destroyed. And then you try to calm them down, and it just does not happen. It don't happen. And sometimes it ends up in them going unconscious. And I don't know whether you would call that psychotic seizures or what, but they go unconscious and they shake like they're having a seizure. So that's another possible side effect symptom of this disorder. Ongoing feelings of emptiness. This is here with him. This is kind of like more like constant, but not always. So it can come and go, as well as depression, and in some people it just doesn't go. So again, this is another one of the symptoms that it just really depends on who you are. Okay. All right. And then the last one is inappropriate, intense anger, such as frequently losing your temper, being sarcastic or bitter, or having physical fights. This can happen. This definitely can happen. Um, they can engage in physical fights, but this is where you differ between borderline personality disorder and narcissistic personality disorder with antisocial personality disorder too. Whereas people with antisocial personality disorder, they probably would get involved in a physical fight, but it would be much more violent, and they likely those people are very strong when they get mad, and it just doesn't. Antisocial personality disorder people, when they get mad, leave. Okay. With borderline personality disorder, you might want to leave, and get away for a little bit and let them calm down. But then you risk, if you do that, you coming home and your house is destroyed, but they're still here. And then they realize that they've done something wrong. Now, people with borderline personality disorder, a lot of times most of the time they do have empathy and remorse. There's a very, very small percentage that don't. But what borderline personality disorder is, and that they can be very manipulating. Antisocial can be very manipulating. Narcissistic can be more manipulating. We tend to see manipulation more in narcissistic personality disorder, but borderline can happen too. But if you borderline is, it's not one of those disorders that is untreatable. It's treatable. And a lot of people that's got it, they tend to do pretty good with treatment. Whereas with some of the other cluster B personality disorders, is a little bit more to treat, a little bit harder to treat. Borderline can be hard to treat too, but in my opinion, and this is just my opinion, borderline and histrionic personality disorder, which is both cluster B, is a little bit more treatable than narcissistic personality disorder, because a lot of times with narcissistic personality disorder and antisocial personality disorder, they can both come with sociopath, psychopath. I would label borderline as, I mean, not label it, but I would say it's one of the lesser severe cluster B personality disorders, as well as histrionic, but it is something that you want to pay attention to. It does. I mean, if I had to do a scale on the 10 personality disorders as to which one is the most dangerous, to themselves, it would be absolutely borderline personality disorder. No doubt about it. Because they often go after themselves and harm themselves other than you. Now, like I said, there's times when the empathy is there. There's times, most of the time with borderline, it is there, but there's a small group of them that it's not there. So you really need to pay attention to a loved one that you think may have this disorder, and if you think they have this disorder, please go and get them some help. And if you are a person that believes that you may have this disorder, I highly encourage you to go get treatment, because treatment is it often works very well with borderline personality disorder. Um, but anyways, and if you get diagnosed with borderline personality disorder, please remember, it's not the end of the world. It's not. There is good days and there's bad days. And that's why I highly encourage you to go get therapy for it. Therapy works better than any kind of medication most of the time. For personality disorders and disorders that are not of the 10 personality disorders. Therapy works better than medicine. Now, some may need some medicine, but therapy works a lot better. Anxiety is another major side effect of this disorder. So, and often with anxiety accompanies depression. People with BPD also have some depression episodes. So, yes, this is why I highly suggest you to get therapy, because the depression and some of the behaviors and stuff, they have traits of other personality disorders. A very few traits of antisocial, some traits of narcissism. They have traits of a few traits of histrionic, but I don't think histrionic is not as equivalent to borderline as some may think. But with bipolar, definitely. Most people that do have borderline personality disorder have got bipolar too. So, and some of them may comorbid some of the cluster A's too, cluster C's and stuff. But this covers one of the really, really tough ones to treat. Cluster B, this is borderline personality disorder. So I hope that you've enjoyed watching my video and what borderline personality disorder is about and what it is. And if you like my video, please drop a comment, hit the like button, and hit the subscribe button. I will try to respond to you as soon as I can. And if you think you have one of these disorders, or if your loved one does, please go and get therapy, because it works for borderline personality disorder. It works pretty well too. So take care, guys. Y'all have a good night, and we will do another video maybe tomorrow or in the next couple of days. Y'all have a good night.